We were all frantic when COVID happened. We were trying to find a solution.
A solution to a challenging problem. Spectrum Health Systems provides addiction services to more than 200 people on its Westborough campus alone. They didn't want to turn away COVID-positive patients seeking addiction services, but they had to keep everyone else safe from infection.
We actually had the perfect space. And it's a 15-bed isolated wing that has its own entrance.
They moved fast to get it ready. MEMA delivered the PPE staff would need on the unit every time they entered. 2 masks, 2 pairs of gloves, a gown, face shield. And in a matter of days, they accepted their first COVID-positive patient.
We're interacting them just as we would on a regular nursing unit.
Anne-Marie Camara is one of the nurses who volunteered to work on the unit. She says at one point, 13 of the 15 beds were filled and some of them were scared.
And am I going to go into respiratory distress? Am I going to be intubated? What's going to happen with me?
Camara worked to ease their fears as they started addiction treatment. Each patient received an iPad for virtual therapy and counseling, as well as access to support groups like Alcoholics Anonymous. Patients spent 2 to 3 weeks in quarantine on the unit, and that isolation, perhaps a benefit to a very challenging situation.
For them to come in and kind of forget the world around them and just focus on themselves, their addiction, and to be able to work through that and have that one-on-one time with their counselor, I think that is definitely the silver lining.
About 46 people have now gone through that COVID unit since it opened in April, and as case numbers have declined here in Massachusetts, they've had fewer people needing it, but they plan to keep it ready just in case.